these truths to be self-evident.
That all men are created equal.
As a member of Congress, I get to have a lot of really interesting people in the office. Experts on what they're talking about.
This is the podcast
for insights into the issues.
China, bioterrorism, Medicare for all. In-depth discussions.
Breaking it down into simple terms. We hold
these truths.
With Dan Crenshaw.
The Eagle has landed.
So across the country, a dangerous experiment is being carried out on our children under the guise of gender-affirming care. Now, what was once a fringe ideology has infiltrated our medical institutions, our schools, even the legal system. Parents are sometimes stripped of their rights to even question irreversible procedures that are being pushed on their children. Kids are permanently altered, doctors are silenced, and we're told this is about compassion. But these so-called treatments, puberty blockers, cross-sex hormones, irreversible surgeries, we're told that they're life-saving. But what happens when the very people who undergo these procedures realize they were sold a lie? And that's what we're going to talk about today. So we're joined by two courageous individuals who know firsthand, one who at least knows firsthand how bad this is. Chloe Cole, been on the podcast before, but I guess we were just talking about it. It's been a couple of years, which is, can't believe it went that fast. You went through gender transition as a child and now fight to prevent others from making the same mistake. And it's very brave, speaking out in the way that you have. Another brave doctor with us today, Dr. Eithan Haim, medical professional who was willing to stand against the misinformation at Baylor, among all places in Texas, and advocate for real science-based care. So let's talk about it. Well, let's do a review of your story, Chloe. We did it on the podcast a couple of years ago, but how old were you when this happened, or maybe I guess before that? Like you maybe talk about the transition from psychologically that maybe a normal teenager is dealing with, and then the steps that happened after that. How any of this happened, where it happened, where you're from.
Right. I mean, before I got into all this, I had fairly normal onset pre-adolescent feelings of discomfort around myself that were exacerbated by some things in my life, like having been sexually assaulted and having to contend with the trauma of that, and also just being kind of a different kid. I was a tomboy. I always felt like there was something that just set me apart from the other kids my age, and it later turned out that I had a learning disability. But there was nothing that was actually wrong with me. I was just a kid, and all that I needed was just to be given the chance to grow up. But I wasn't really afforded that opportunity. And instead, because I wanted it, my doctors led me down a path of irreversible change to my body. And so between the ages of 12 to 15, or 12 to 16, I was going down the route of a medical gender transition as a little girl into the identity of a young man. Yeah.
And like what you say you wanted it, right? So how much is, the internet gives us all the information we want, right? Even the dumb stuff. Is that basically what happened? I mean, you're a kid, you're feeling what a lot of kids feel, and you're like, okay, there's got to be a reason for it. You start researching it, go down these rabbit holes.
I mean, if it weren't for the internet, I would have had no clue about any of this. I didn't learn about this through school or through like a rogue teacher, counselor, or anything like that. It was primarily through the social media networks that I was using. And what started, it really began with me just browsing these seemingly innocent communities around things like video games that I played or my hobbies that I had. But a lot of the kids in these communities were kids who identified as transgender, primarily young girls who called themselves boys. And seeing these other kids talk very honestly about their experiences and seeing just how similar they were to me was primarily what drew me into it. And within the transgender community, there was a primary focus on two things: seeking affirmation, seeking the next big thing. So looking for a sense of gender euphoria, right? By trying to appear like the opposite sex, by having other people refer to you as a member of the opposite sex, or on the medical side of things, which is what that eventually leads into, because it's like you're chasing a high, essentially. You're told that this is going to make you into your real self, that you're going to be happy, and that this is your path to becoming whole. But eventually, everything everything just goes to normal. There's a honeymoon period that goes away. And the only choice that you're given is to go deeper and deeper into it.
Yeah. And in your first experience with doctors, so this is happening just like, again, what you now describe as kind of normal adolescent problems. And then I guess your parents take you to a psychologist. Like who was the first person to, I guess, insert this ideology of affirmation in there?
Well, it didn't start with a single person. It was just that influence of seeing other kids my age doing the same thing.
But eventually you see a doctor.
And eventually, yes, I eventually saw a psychologist, which my mom and dad decided to do for me because they didn't really know how to handle this themselves.
Yeah.
But they thought that they had very reasonable expectations. They were sensible. They didn't want me to actually undergo any medical procedures. And they didn't believe that I was their son or that I was transgender or anything. But they wanted to have me get real psychological help with these things that I might have needed. But their expectations were completely subverted, and they were not really allowed to partake in these appointments, so they couldn't really actually help me with what was going on. And they had no idea what was going on in my head or what was being discussed between me and the psychologist.
Yeah.
But when they talked to the psychologist and eventually down the line physicians themselves, they were told pretty much at every step of the way that it was going to be a matter of life or death for me, that this was an innate part of me, that I could not escape it, that it was not a phase, but that if I weren't affirmed, if I weren't told yes to basically everything that I wanted, if I weren't allowed to go down this route of permanent medicalization, my mom and dad were told that it could eventually lead to my death, that it was a matter of life or death for me, and I probably would commit suicide otherwise, that I was less likely to regret medically transitioning than I would just going through a normal, healthy puberty.
Yeah.
And when you're presented this ultimatum by your child's doctors that your own child is going to die, and the only choices you're given are between medicine or death.
Yeah. That's wild.
If you love your child, you clearly
and
want
your
to
parents
choose
feel
what's best for them. And that's what my mom and dad were convinced. Absolutely. It was complete emotional manipulation.
This was in California. What area?
Yes, this was in... Well, I live in the Central Valley, but we had to go into the Bay Area, which is one of the major hotspots in the entire country, actually, for these treatments.
Right. So, I mean, the Bay Area is obviously very left-leaning. You're going to have, it's like, because one of my questions was, one, how do you feel about this as a doctor, hearing this? And how prevalent is it? I mean, how unlucky was she that maybe she just got the wrong doctor? It could have easily had an appointment with a different doctor and had a totally different history.
Well, I live in almost... It's a more rural area, actually. But they keep referring you out to areas where it's more like geographically prevalent, so that you can go down this pipeline.
Gotcha.
And hearing this as a doctor, what these people told you and your family is absolutely horrifying, because I see patients every single day. I operate every single day, and when I tell them in clinic before I take them to surgery, I have to make sure what I'm telling them is accurate. Because we have to fix an actual problem, because I'm going to see that patient afterwards. And if they're not doing better, that's a problem. But like if I didn't find a problem in the operating room, that's an even bigger problem. Like I've done a couple hundred cases over the past year and a half.
Now, what kind of doctor are you? Let's start there.
I'm a general surgeon. I was the Texas Children's Hospital whistleblower. Yeah. And
we're going to get to your story. We're going to get the details as well.
And in every single one of those, the pathology I believed beforehand that was there. So these people are taking you down this path, right? They're presenting themselves as experts when they have a fundamental misunderstanding of the pathology they're treating. And that's a big deal, because you can't necessarily say that an informed consent was ever done, because an informed consent requires two parties. Right, you have the consenting party, which was, you and your parents, and then the informing party, which is the doctors. If the doctors are misinformed about what they're doing, that's a problem. That's a major problem.
Yeah, it is. I mean, we know now. I mean, this is years ago. So this is 8 years. You're 20, yes. Right? So this is 8 years ago. there's been a lot of good debunking of the pseudoscience that I think they were referencing, right? That they'll reference a study that shows a 2% regret rate or something like that. Then
That's what they told my mom and dad.
Yeah, and then you look into it and you're like, well, wait, this study wasn't even done on kids. Like this is mostly adults in this study. It's not. It's like within a year too. It's not really longitudinal.
Right.
There's a lot of problems with the way the study's even designed.
Yeah, the manner in which these studies that they usually cite is incredibly flawed. There's lots of patient dropout, and they don't follow up with it. They lose a lot of their patients, and they don't define regret. They don't define it on an objective scale.
And you know, it's important because like the doctors who are citing these sites, like the 2% number you mentioned earlier, the doctors who look at them have the responsibility and have the knowledge and education to be able to evaluate them and know that they're fraudulent.
Yeah. It's more like obsessed with an ideology. I mean, they discredit their own brains, like their own objective thinking, to adhere to this. What is really a social trend. I mean, it's like you said, like you never would have known if this was a thing unless you'd seen it on the internet. We see evidence of that in other studies where it's like, okay, if you know somebody's transgender, you're this much more likely to say you're transgender. It becomes a social trend,
right?
And adults aren't getting in the way and being like, hold on. Like, you know, it's just not true.
And that's the doctor's responsibility, too, to make sure that those social trends don't translate into irreversible damage to their patients.
Right.
And this is something that is primarily affecting young women and girls right now who we have known for decades are just more prone to different social contagions because we are the more socially oriented sex. We've had other contagions such as self-harm, plastic surgery, body dysmorphia, anorexia.
Yeah.
And there's often an overlap between the two.
Right.
Patients will often go between gender dysphoria to anorexia or vice versa.
And we don't tell somebody with anorexia that like, well, actually, you were born this way. You are supposed to be deathly ill skinny. Like, no, That's not what we tell them.
The very premise of this treatment is fraudulent because you cannot actually become the opposite sex. There is no physiological marker that is actually making these patients experience these feelings of distress. They're just that. It's distress. And it comes from a place of psychological pain and often trauma in previous years of one's life.
Let's talk about your story, Dr. Haim, with Texas Children's as a whistleblower and the journey that ensued from there. That's not something we've posted a lot about your story on our social media. We've never had you on the podcast, so give us the summarized version.
Well, my name is Eithan Haim. I'm a general surgeon. I work in a small town outside of Dallas. But when I was a surgical resident at Baylor College of Medicine, which is affiliated with Texas Children's Hospital, where I did my training, I found out that the TCH Texas Children's was lying about the existence of their transgender program. Because
is this after Texas made it illegal?
This was before.
It was before ago.
Yeah, because in March 2022, they released a public statement saying that they were going to shut down the program because of the potential criminal ramifications. And that's an important thing because they said potential legal criminal ramifications. Because, a month before that, a few weeks, the Attorney General of Texas, Ken Paxton, said that it could be investigated as child abuse, right? So, I would argue that this has always been illegal, but the hospital says that they're not doing it anymore. What happens in reality is that 3 days later, they get back to it. Over the next couple of months, they just continue and then expand their program into a multidisciplinary clinic. And for a children's hospital to lie about something like that, to take it off their website, right, to scrub the internet of this
and especially one as prominent as Texas Children's. It's one of the best in the world.
Because it is. I mean, it really is one of the best children's hospital in the world. Because I've worked there, I've done tons of transplants, tons of surgery there, and their other departments are amazing, but they have a problem with their administration. And for them to lie about something as significant as this is very bad for people who run a children's hospital, right? Because there should be some degree of moral clarity, some standard for behavior. So I didn't believe it for months, but after a certain point, it was clear that this was happening, and I blew the whistle in May of 2023 with Christopher Rufo, and I was the anonymous whistleblower. And then the day after the story comes out, right, it's all over the news. No one knows who I am. That's when the Texas Senate on the 17th of May voted to pass SB 14, which made it illegal. and there were a few Democrats who voted in favor of it. One of those, Sean Theory, she was here today. It was amazing. But
we had a for those listening, we had a press conference today with our two guests and many more advocates on we're calling Detransition Awareness Day. So that's the context.
And so the bill was passed within 24 hours. Another whistleblower comes out a couple days after that. The AG announces an investigation, and then the CEO says he's going to shut down the clinic for good. Mm-hmm. Of course, this was under the Biden regime. So a month later, 2 armed federal agents show up to my home and inform me that I'm the target of a criminal investigation about medical records. Mm-hmm. And thankfully, my wife is a attorney. She's a federal prosecutor at DOJ, actually. So she advised me not to. She advised me not to speak with the agents. But what followed in the next year and a half was just the most corrupt prosecution. Just a series of events that were truly unbelievable, where they were charging me with a HIPAA-based crime, even though no patient information was released. Yeah. And they were saying that the victims were not patients, right, which is what HIPAA is meant to protect, but rather it was the hospital and the doctors who are the ones who are being granted privacy protection by HIPAA because they were the victims in the indictment, right? And that was the basis of all of their charges. And they were going to send me to prison for 10 years.
Jesus.
And it turns out that the lead prosecutor who brought this case, you couldn't throw a tennis ball at her Thanksgiving dinner without hitting a TCH donor, someone who was on the board, or someone who had business with Baylor or TCH or one of the hospitals in the consortium. Of course, once we made the DOJ aware of that, she stepped down. But that didn't stop them from trying to gag me because I was criticizing their case. Because they had 2 indictments fall apart, right? And this is hundreds of thousands of millions of dollars of legal fees that we have to pay in order to fight this case. We're still $1 million in the hole. But they left a typo in their indictment. They charged me with a non-existent crime, right? The lead prosecutor, the same lady, was practicing without a license, with a suspended bar license, which is a felony in Texas. Wow. And in January 24th, the day before that, I was confident I was going to jail because I violated this de facto gag order from the judge. And I was giving my wife all of my media contacts, and we were getting ready because I was operating the next day. So I was going into the hospital the next day thinking there's a good chance I'm going to be arrested.
You're still at TCH or a different hospital?
A different hospital. It's a small hospital in a small town outside of Dallas.
Gotcha. Which is where you are now.
Which is great. Yeah. I mean, these people are amazing. And then luckily, that's when the right people got involved. They gave guidance to the Southern District of Texas, where this was being tried, to drop this case with prejudice because it's completely bogus, completely corrupt. And so the same day I thought I was going to jail was the day that the case was dismissed with prejudice.
Was that, sorry, what day was that?
That was January 24th.
Of this year?
Yeah.
Okay. Yeah. So maybe an election had something to do with that.
Yeah.
We had made them aware of your case. I mean, I think they were tracking it really well, and thank God for Trump and Pam Bondi. I'm sure we're now at least fighting for the right people. I mean, that's years. Because when did this first start?
It was in 2023. So this was going on for a long time, and I can honestly say that there was no point where we wavered, because what had really inspired us, because it wasn't just me, it was a whole team of us. When we saw stories like yours, I mean, those were the stories that I was hearing when I was first being exposed to this whole ideology, because I didn't really know about it before 2021.
And how extensive was it going on in that hospital? It's hard to get numbers on how extensive it is nationwide. So from what you saw, how extensive was gender affirmation care? And maybe categorize it too into, puberty blockers, hormone therapy, and then also how much of it's actually operational. I mean, surgical procedures.
Yeah. So what was happening at Texas Children's, as far as my knowledge, was hormones and puberty blockers, which I would argue are just as severe as the surgeries themselves, because they're like surgeries from the inside out on a microscopic level.
Testify to that.
That's absolutely true.
Yeah.
They're just as harmful.
There's no surgery in the world that can prevent the progression of a person from going through puberty, right? There's not. So in terms of prevalence, like how big was this? So the reason I blew the whistle, the thing that took me over the edge was that the directors of the program that supposedly did not exist were speaking at the hospital's Grand Rounds lectures, which is funded by ACGME, which is involved in the bill you're trying to pass. So the Grand Rounds lecture is the most prestigious lecture series in the hospital. It's given every week, everyone attends. And think about it, right? This is the biggest children's hospital in the world, the biggest department of pediatrics in the world. So their Grand Rounds is a big deal. So the directors of the transgender clinic were speaking at this lecture series. They talked about their algorithmic approach, right, with social affirmation, puberty blockers, hormones, and then surgery. From what I saw, they would refer the surgeries out, right, to other hospitals. But they would do the puberty blocker surgeries in-house. But this was a multidisciplinary clinic, right? You had social work, psychiatry, psychology, primary care, endocrinology, and then surgery for the insertion of the implants. So this was a system that they were instituting into every aspect of pediatric care at Texas Children's Hospital. This was becoming their standard. So if you came in through the ER or you came in through the pediatrician's clinic and you had any indication of this, they had an entire pipeline set up for you to go through. And this was in the heart of Red State, Texas.
Yeah, it's kind of terrifying. What's the youngest you guys have? What's the youngest child you've seen go through this?
From what I
we
saw,
know of?
Getting puberty blockers was 11 years old. 11 years old before the onset, Tanner stage 2, before puberty, before the development of any secondary sexual characteristics. Yeah. And these the effects from these medications are profound.
There's one of the most prominent transgender surgeons, Dr. Marcy Bowers, has admitted that in the patients he's seen who have been blocked before Tanner stage 2, they never fully develop sexually. They're not only infertile, but they are never able to experience any sexual pleasure or function, never even an orgasm in their life. And
it's because when you block the onset of puberty, you have your penis, your secondary sexual characteristics like your breasts, they never grow. They're locked into like a frozen time frame of your pre-adolescence. So that's what happened to Jazz Jennings. That's why they had to take some huge flap from his thigh, I think, to construct this this pseudo penis. And to think about the morbidity, the cruelty, and the pain and suffering that has to be dealt with after that is unimaginable. Because not only they don't have sexual function, it's like it can't function properly, right? Like it's this delayed, this kind of somewhat defective. Well, it is a defective organ.
Well, what's strange is you think puberty blockers, but it's not like you're blocking one sex's puberty. But it's not like that creates the pathway for the opposite sex's puberty.
Well,
you just
the
have no
idea
puberty.
is that it blocks out all of the development and the hormone production to make way to attempts to simulate the opposite sex puberty.
Which is impossible.
Yeah,
completely impossible.
Which is so crazy because I'm not a doctor, but I can think of the logic here and admit, and there is none.
Yeah,
Right,
it doesn't actually change your sex. You just end up with some of the secondary sex characteristics of the other sex, while also.
Well, they try to give you testosterone to boost whatever that sex is, which is what they gave you, right? And how long did they do that? And maybe kind of going back to your story, Chloe. How long did that take place before you were like, I don't think this is working?
So I was on the puberty blockers for about a year to maybe a year and a half, and for most of that time, I was also on. I had started the testosterone as well, so I was on the testosterone for about 3 years and a few months, from 13 to 16. It wasn't.
We won't give Navy SEALs testosterone, by the way. We literally, our military will not give guys who have low T levels testosterone, but hey, the medical community says it's fine for 12-year-old girls.
It's a controlled substance, and it's incredibly difficult to get if you actually need it. But we're giving it to these teenage girls like me who have no actual use for it and will actually suffer from taking it. But it was the surgery actually that made me realize this is a lot of damage being done to my body. for something that isn't really an issue in the first place. I'm not broken. I was never made wrong in the first place. It started to really hit me at where these feelings were actually coming from, that they were coming from a place of pain, of different social traumas, and that I very well could have lived without it. And sure, like, these feelings were not easy for me to deal with, but this did not make me feel any better. And maybe I felt more masculine or more male or even happier for just a little bit, but that was temporary. And now I was having to contend with the permanent effects of every single one of these procedures.
What happened to the doctors who put you down this path? Like, have you written them a letter? I mean, what did they? Is there any, I guess, accountability at all here?
Well, you could say I wrote them some form of a letter.
Yeah. Have you named them?
A lawsuit.
Yeah. Oh, a lawsuit's good. Yeah. For malpractice, for
malpractice, fraud.
Yeah.
Damages.
Is that ongoing?
Yes. I am currently suing my surgeon, my endocrinologist who put me on the hormones and the blockers, and the psychologist who referred me to surgery, as well as Kaiser Permanente, which is they're both an insurance company and my healthcare provider, which a lot of people have a problem with and consider a conflict of interest, which I'm inclined to agree with. Nobody really likes Kaiser.
So soon, all of them, and this is what was brought up today in the press conference was need for legislation to one. I think create a actual legal liabilities for some of these practices because there currently aren't any. Your case will be interesting to see where that goes.
It's going to be a trailblazing case. It's not the first, but it's one of the first of its kind. And I was lucky enough to have detransitioned before I hit 18 years of age, and for me to hit 18 like just before the statute of limitations ended.
Okay,
Most of my friends,
about that.
they end up detransitioning when they're in their early to mid 20s, and they're way outside the statute of limitations, so they just have no chance, which is abysmal. Because for most people, it takes a long time for it to really hit them, to be able to really assess what is actually happening to them, how they really feel about it, and just to be able to mature enough to do that.
Do we have good numbers on that now? After this has been a trend for a number of years now. Do we have any decent data on like the actual regret rate? Is it kind of hard to come by?
I think it's probably hard to say because when you have every component of society, every part of like their friend group, so many forces that are keeping them in this lifestyle.
Yeah.
I think it would be nearly impossible to truly understand the regret rate, because I'm sure if you can really, ascertain like how these people feel, I'm sure these people, would say that they immensely regret their decisions.
Right.
Because there's no way to go back. I mean, once you go down that road, there's never going back. And there's so much that they give up. And especially, like, I just had my first baby, and it's like, how much that means. Like, I look into her eyes and she smiles. It's like, just like makes my heart melt. Right. Yeah. And you don't know what that means until you have a kid, until you want to start having kids. And there's this entire generation, like you said, that is going to wake up one day and realize, like, man, I've been butchered. And those people, they have to be held accountable. But even lawsuits, like malpractice lawsuits, I think that this even goes beyond that, because these are doctors who should know, either they do know or they should know, that what they're doing is mutilating someone, right? If I were to do that, I would go to prison. There's people in prison today for the same thing, but just in different fields. What these people are doing is a crime, right? Because they're negligently kind of imposing this intervention program onto these kids and adults that they have no evidence for, but they're blackmailing them with the threat of their own suicide.
Yeah.
Which is the craziest thing, right? You can't provide consent under the duress of your own suicide. And as a doctor, you have a responsibility. Like, you can't just say anything you want.
Yeah.
Right? If I told my patients, like, oh, if you don't get this hernia surgery, you're going to kill yourself, that'd be a problem. That'd be a huge problem.
Right. That's pretty wild.
Right. There's so many different factors that make it so difficult to detransition. Like, I didn't know that it was possible until it ended up happening to me, and I made the decision to. It was never talked about as a possibility or as a possible consequence of treatment that I could regret it, or that I could even choose to go back. And there's so much social pressure to just stay within it, even by my own doctors. I even had a doctor tell me that my detransition was probably just me either being non-binary, or that it was a part of my continued gender journey, that it was just another transition. And there's no protocols to handle those of us who detransition. So there's just no way for doctors to really report in the system that that it's happened. We are not recognized by the medical community at all. And even when I went back to all my doctors for all these different complications I was having, to report that I no longer felt like I was a boy, that I wanted to that I was in pain because of all of this, I was ignored completely. It was like their attitude around me completely changed. They turned the other ear, and I was just like one of their little mistakes that they wanted to throw in the garbage. I even asked my doctors to change my name and my sex marker back to my birth name and to female. I'm not even with Kaiser anymore, and I still get letters from them addressing me as a young man named Leo.
Oh my God.
Wow. That's wild. That it proves it's just such a, it's an ideology. There's just and how it came about is, I mean, the source of endless discussion and debate that dives deep into weird leftist tendencies to always progress to the next strange thing, because that's progressivism, progressing towards what? I don't know. Whatever the hell we think of the next.
It's not exactly supposed to make sense.
Yeah, I mean, it's always, you can't really predict it. And it's just so obviously foolish. I mean, I use the example of okay, so if I have a young daughter too, a year and a half, she sees her daddy growing up with one eye, and okay, well, now she identifies as a one-eyed person. So as a doctor, well, hey, you need to affirm that reality for her. And I would argue that one eye or two eyes is significantly less important than your gender, actually, which is so. But we would cringe at the idea that you would remove a child's eye because they identify as a one-eyed pirate.
And what would happen to that doctor if they did remove a child's eye? They would be in jail. And how is this any different?
And yet this is so much more significant.
Exactly. And it's the next part of the movement, right? Like what we have to do is kind of realign the Overton window with reality, because the Overton window has been all the way over here, where it's this is normal, this is fine, this is good, but we just have to bring it back to where it should be, where this is a crime. Because just like the point you made, and before, you don't have to be a doctor to figure this out. You don't need a randomized controlled trial to tell you not to drive your truck into a ditch.
Yeah.
This is basic common sense. This is completely and utterly insane, especially when the leaders of this movement are these cross-dressing men who make Buffalo Bill look like Mrs. Doubtfire, right?
Wow. Yeah. That's quite the scene.
I mean, I think we've already had that. We've mostly already had that Overton window shift.
Yeah,
and right now, the left is having to contend
are?
with the fact that they've lost, I think mostly because of this issue. People have just gotten so sick of this abuse of our children and all the other things that come with it. Men entering the restrooms and locker rooms and private sacred spaces of women, beating up little girls in their sports, and all of these just ridiculous things that are...
It's the series of actions that has led to this reshifting of the Overton window, all those things with the sports, right? And then people like you, detransitioners telling their story, people like you, politicians questioning Yale doctors who have no idea what they're talking about, can't list one study.
I thought she was going to list some studies because I have the studies. I know, I know their list, and so we had a rebuke for every. I was going to be okay, you're going to list that one, you're going to list this one, and we're oh, well, actually, that one, here's the problems with it and the clinical design.
It's always really disappointing when they don't actually do it.
That was actually it was the opposite. It made for a great scene because she was just looked down and was I was okay, nothing. Okay, that's what I thought. You're done. This conversation should be over. And I'm Democrats, what are you guys doing? I mean.
They're not saying their best. Yeah, it's less fun that way.
Well, but I mean, it's an impossible position to defend. To be fair, why would you try to defend it? And and the Democrat Party is going through that political, insider talk on how to get out of it. But
I mean, they're at that point now where I feel could defend it better than they can, but it's like they're losing, like they've been completely demoralized.
They should be. I mean,
they're scrambling.
So it does. I mean, that's kind of my question for you guys. That you're in this every day. Do you feel like we've made progress since we last talked? I mean, what's your life been like since we were last on the podcast a couple of years ago? You haven't stopped, right?
Not at all.
You kept going. So what are you seeing?
I feel like a lot of change has been made in different areas. Primarily culturally and of course legislatively. Yeah. And it's really exciting to see your bill actually start to come into Congress, because we're in desperate need of federal legislation on this issue, because the executive orders that Trump is putting out are awesome. They are like the best first step that we could have, and they're going to make way for even greater changes to happen. But we need to keep riding that tide. We cannot just slow down and stop and get complacent, because if we do that, the left can reassemble and they can make it so much worse and reverse all of the movement that we have done.
And we shouldn't underestimate them too, because I mean, these people are brilliant political practitioners and strategists. I mean,
they're not just going to go away.
Exactly. I mean, and they have huge amounts of money behind it. I see the executive orders as kind of like stopping like the hemorrhage, right? Like if you have a bleeding blood vessel.
Well, you can only do so much with an executive order. Just legally speaking, it can only affect federal money specifically. Mm-hmm. It's you got to codify a lot of this, and that's why we focused on the GME funding, because it really gets at something a children's hospital absolutely needs, as opposed to Medicaid, which is what we're going to have to do. Now we're getting into like complicated talk, but because we're going to pass reconciliation, so passing the GME bill is hard because you need 60 votes in the Senate. We got to shame some Democrat senators into voting for it. But we can do is because it's a budgetary effect, fix some of this through Medicaid payments, which is still significant and at least codifies what the administration's looking at. I'm hopeful. I think that part's easy. The whole bill of reconciliation is a whole other difficulty to get through as a mass of legislation. But we're hopeful.
The children's hospitals, where you have the biggest programs in the country, at least 50% of all of their funding comes from Medicaid. Yeah. So if you were to, which is why all of these hospitals had immediately released statements saying they're shutting down their program, because the threat to Medicaid is so great that the hospitals will become insolvent without that funding. Yeah. So if you threaten that, big deal. But also ACGME, the like graduate resident funding is huge, because say you have these big academic centers, if they were to lose the funding for one or two of their programs, then you have these massive services, like these medical or surgical services, that are all of a sudden gone. Mm-hmm. So that's going to hugely interfere with the functioning of that hospital. And they're going to, instead of like the chaos that would ensue from that, more likely what they're going to do is comply. Yeah. So it's just another avenue.
Yeah, I mean, it's a risk management for them at that point. They'd have to be pretty crazy to risk that. Although some are. I mean, we've seen whistleblowers talking about, because it's illegal in Texas now, but we're seeing whistleblowers from some hospitals talk to us about how they're coding Medicaid, like endocrine therapy, right? It's just endocrine therapy. Who's gonna how are you gonna know what that is? It could be that could be a lot of things, but that's how they're coding it, getting Medicaid to pay for it. And that's the problem that DOJ has to look into.
And that's, it's hard to overstate how much of a crime that is. That is like, go to federal prison, don't get out of jail free card. Yeah. And that's a huge deal. There are entire departments within hospital systems to prevent that from happening. But
how do they circumvent that then?
Well, so they circumvent it because they just put a different diagnosis. The administrations don't know because they bypass.
So not even like the hospital knows. It's like like an activist doctor, because they can just fill out the paperwork differently.
Exactly. Yeah, and no one knows.
That's fraud. That's Medicaid fraud.
100% insurance fraud. Yeah, you go to jail for that. And the thing is, can we really blame them for doing it? Because like they've been getting away with like over criminal activity for like over 10 years. And there's been no consequences.
But they of course, they think they're doing some social justice for them.
Because they're so ideologically captured.
Yeah, I mean, they believe they're doing the right thing. These aren't people who like believe they're doing the wrong thing and just like, screw it. No, they have this crazy ideology, and it's hard. I don't know how to like get somebody out of that, right? Like, I was asked today about how Democrats really feel, and I'm like, there's no way they all believe it. I'm like, there's no way these guys. I know a lot of them. Like, there's no way you believed this 5 minutes ago, guys. Like, this is. Clearly a social contagion that has overtaken a radical wing of your party, and you feel you can't win a primary without, bending the knee to it. Like, that's obvious to me. And I know it's obvious to you. You won't admit it to me, but I know it's obvious to you. Like, at a certain point, you just got to say no, because you did lose an election largely based upon issues like this. Like, the best data we have, 70% are, if you ask the public, 70% are against using puberty blockers and hormone therapy on minors.
Oh, it's even higher than that.
Well, I was going to say, that's just a question the Washington Post asked, right? It was 70%, but I'm like, it's probably 90% easily if you add also surgical interventions to that question. I bet it's a massive people, massively against it, and for good reason. And then we see left-wing governments in Britain making it illegal. Like, I don't know when our own left wing here is going to follow suit.
And I think the challenging part is that, like, when you have the American medical establishment who've doubled down so hard on these interventions, for them to ever go back, self-reflect, they would have to come to the unavoidable conclusion that they were the ones who were destroying the people that they were supposedly taking care for. And the people they were calling monsters, like us, were actually the ones who were trying to protect these children. And just imagine being that person, right?
Mm-hmm.
Like to self-reflect is to self-immolate. And it's like Imperial Japanese soldiers on like Okinawa. Like they would like rather chew on a grenade rather than surrender to the Americans, right? Jump off a cliff.
Yeah, the ideology is that strong.
I mean,
Exactly.
speaking as somebody who went through it myself, like that's why it was such a slow burn. It took such a long time for me to actually end up detransitioning, because like it was so hard to fathom that I went through all of this just for nothing. And the ideological indoctrination is so deeply ingrained in you. Like, you're led to believe that this is reality, that this is the only reality. This is all that people who are dysphoric, people
Was there
who
somebody who
identify as
helped
transgender
you?
have.
Was there somebody who helped you get out of that, or did it just was it your own awakening that you were sort of alone in?
Well, it was a mix of both. I mean, it kind of helped that I was.
There was no
like
Chloe
the
Cole.
COVID.
There wasn't
the
a
COVID
Chloe
era.
Cole at the time.
No,
that
not
you
at
could
all.
look to as a social media influencer, basically, and say, "Hey, I can draw inspiration from that."
No, I didn't know any other detransitioners. I was the first one that I knew of, and for me, it took a very lonely, just horrific period of isolation during California's lockdowns for me to get to that point and like really truly reflect. And it was like my mind was like being just absolutely flayed during that time. But that was what it took for me to really fully understand just how much damage it was actually doing. But I had to actually speak to other detransitioners in order to start to have the final walls of this ideology sort of crumble and fall down. I needed to be challenged by other people who had been through the same thing, who understood what I was going through.
And were you able to find them?
Yeah. So it's funny because for a few weeks after I stopped transitioning and I stopped taking the hormones cold turkey, which was absolutely abysmal, by the way.
What does that do? What does that do to you?
Oh, I was sick as a dog. Yeah. I was like 2
so
months.
It was like withdrawal. I mean, like,
yeah,
so
with total withdrawal,
Really?
like no sex hormones in my body for like a few months, basically. I dropped like 30 pounds. So I was like emaciated. I was super sickly. And I was like getting blood clots and stuff. It was terrible. There was like a 2-week period where it was like, what am I doing? What's happening? And I kind of like put 2 and 2 together and was like, so I stopped transitioning. It's a detransition. Is this a word? Like, I'm going to Google this and see if anything pops up. And surely enough, like there was this massive community. Well, at the time it was much smaller. But there was like this community of thousands of other people who were interested, at least in the topic of detransition, or had detransitioned or desisted themselves. Mm-hmm. And talking to these other people, I was going through so much pain and also just so much confusion. Really, these people really served as my anchor for a little bit for me to fully understand like what was actually happening to me, and what happened to me in the first place. And like at first, like I couldn't even bring myself to call myself a girl. I was just like, well, maybe I'm non-binary. Like, how can I even deserve to call myself a woman after losing my breasts? Like, I'm never gonna feel like I'm pretty again. I don't know if I'm ever gonna sound or look like a woman again. So how can I like escape the shame and even come back to that? But these people helped me understand that I didn't ever lose my sex. I never lost my status as a woman. That I didn't lose my worth as a human being because of the things that happened to me, and that all of this was just wrong in the first place, that I couldn't actually ever become a boy, no matter what drugs or what surgeries I undertook, and that was okay.
It's so powerful, and I think now people can look to your story, and I think that's what's so amazing about it. It takes a lot of courage to do that because there's people feel alone. And
I want to be that person who people can look up to, like people who I was able to.
What do you say now? I mean, what would be advice to parents or kids, going through adolescence issues, of which there are many? How do parents fight a system, especially in a place like California, where they're constantly trying to pass laws that would they'll remove the parents from the equation, period. Texas is like on the opposite end of the spectrum. We're making it illegal. There's other states not doing that, doing the opposite. How do parents hopefully it's easier now than what your parents had. I mean, Elon Musk tells the same story, right? He felt he was tricked into this. And it's heartbreaking as a parent. I can't even imagine.
The older I get, the more horrifying it gets to me. But the thing is, as a parent, you cannot bend the knee. You cannot affirm your child's wishes or their identity, and you certainly cannot give in to these medical professionals or these other adults who are trying to take your child away from you, because you were the one who created them. You are the one who had them. You are the one who has raised them, and you understand them best. You know that they are not the opposite sex. You know that they are not transgender and that they are beautiful as they are. So do not say yes at all. Yeah. Shield your children.
Well, it's
protect
scary
them
too,
as much
because
as you
there's
can.
that case in Texas where the father and mother. So the mother was trying to transition the boy into some girl, and the father was fighting it in court. I'm not even sure what happened with that case. Maybe
no, he's still fighting it. I think.
Yes.
Yeah. In California, he just had a big update, or he was filing something. I can't recall his name, but that case is still ongoing. I was after I took my story public, I was in contact with a parents group in Dallas, and these are parents of children who have been taken in by this ideology. And I got pretty close with them. They're pretty remarkable people because they have a huge impact on local legislation, like in Texas, but then also nationally too. So they had kind of binded together out of this shared trauma and experience of having lost their children to this ideology. But there was a few of them that had really insightful stories about how to protect their kids, because one of them said that their child had started transitioning, and they said, you're cut off completely. No money, no contact, nothing.
Which is the worst thing that you can do.
Well, in this case, it actually worked. Huh. They ended up living on their own in a really bad neighborhood and working at a Taco Bell for a year and a half. And then after that, they went back and were like, it was a bad idea, And
I'm glad it worked out in that case, because in a lot of cases they end up becoming dependent on other people.
Yeah, you can go a number of different directions.
And in some cases too, just withdrawing the kids from the schools and getting them
just resetting your social life.
Yeah. Because that has to be a huge part of it, right? It's like when you have your friends, everyone's into the same thing.
Your friends in high school, middle school, or everything. I mean, you can go off in a really crazy direction if you have the wrong group of friends. It's just a natural truth that we all live with. Parents only have so much influence. Yeah. We're going to deal with that with our teenage daughters. It's just going to be. What do you we've been talking about minors, and that's of course the focus of my legislation. Adults do adult things. What do you tell? I mean, if a 25-year-old or a 30-year-old comes to you for advice, what do you tell them?
Somebody who's experiencing gender dysphoria, you mean?
Yeah, somebody who wants to go down this path, but they're an adult. They're not the focus of Texas legislation or my legislation. I mean, what do you tell them?
I would say that if it's wrong for kids, it's wrong for adults.
Yeah.
Because at the end of the day, doctors, what they do is treat pathologies. We treat pathologies to make humans better, like to return them to their natural physiological state. What this is the opposite of that. The hormones and then the surgeries for adults. In the case of hormones, you're destabilizing their natural physiological state.
You're creating pathologies.
You're creating pathology. And then for the surgeries, you're deconstructing natural function. Mm-hmm. Right? So this is just as wrong for adults as it is for children. And the difference between radical cosmetic procedures, right? Because a bunch of people bring that up. So there's a legal and medical definition that's very important, because the reason reconstructive surgeries are billed and covered by insurance is because they restore form and function. The function is the important part. So if I got burned really bad or bad car accident where like I lost my jaw, they would take a portion of my fibula from my leg and plaster it onto and there's a proper way that's done, right? But it restores the function of being able to eat, right? Like a natural physiological function. That's reconstructive surgery. Cosmetic is when you alter form with no effect on function, which is why it's not covered by insurance. And
the crazy thing is that these initial surgeries are completely cosmetic, and they're only for the purpose of cosmetic changes. They don't actually bring any function to the body. These are completely non-functioning body parts that these patients are left with. And yet when a patient wants to have reconstruction or restorative procedures, it's not covered at all.
Yeah,
it's not even guaranteed as a possibility, because like in the way that they perform the mastectomies, for example, they're different from cancer mastectomies. They leave less tissue, and they don't really account for reconstruction after the fact because they think of this as a permanent procedure. And especially with the genital surgeries, like there's no going back.
Yeah.
There's only mitigating the problems that come from it.
And those
That's
surgeries, by
terrifying.
definition, are not only cosmetic, but like they're deconstructive, because you're removing a natural, critical physiological function, right? Which is like the super important thing, because for the breast, right, no lactation, right? You also have it's part of your natural physiology.
Yeah.
But there's a function to it. And then for the, euphemistically called bottom surgery, you're destroying your entire like urinary pathway, which is like, I deal with these complications in my practice, is an absolute nightmare, right? This is a natural function physiologically that is being destroyed.
And this idea that it's like the medicine has evolved. I mean, I just don't believe it, because the left will fight with me. Even like what I would consider what I thought were logical left wingers, battling me and as I defend the Trump administration's banning of transgender serving the military. Like, coming from the military, look, you can't deploy if you haven't had your teeth cleaned on time. Like, like our deployment, I had to be medically retired because of, I can't technically pass a dive physical, even though I dive just fine. I still dive today. But technically in ocular space, an orbital, a hollow orbital, even though it's not technically hollow, whatever. They're like, we can't check that box. So you're not deployable anymore. And it's like, okay, but you can have these procedures, like as you're describing them, are massively consequential, and also require just a massive amount of follow-up. I mean, and medication, which is the exact opposite of what we allow on a deployment to austere environments.
And what's really funny is that even when I was transgender, and partly because my own family has a military background, I probably understood this a little bit better than the average transgender person, but I was completely on board with Trump banning transgender people from entering the military, because it's a psychiatric issue and you're dependent on medicine basically for life in order to maintain this lifestyle. Like, it's really, I feel like there's been like a big cultural shift in the transgender community since I joined it. And I definitely was one of the more conservative people when I first started my transition. And I didn't get why, like, the women's sports issue wasn't as big then as it was now, but like, I chose to forfeit going into sports because I knew that I was taking a performance enhancing drug. Like, I could not compete on either the level of the males or the females my age, because I was going to be basically a category in between. Like, I would easily be any girl and like have it be super unfair, but I never would actually physically be on par with a young man.
Yeah,
which sucked, because I had people tell me that I looked like I could play football, and I really wanted to.
Yeah.
Last words. I mean, and how do we, again, like, look into the future? We're feeling optimistic about this, about winning this battle.
I think that this fight was won by people like you, average people like me, who are willing to, just push back and not give up, because it's pretty remarkable. I mean, like, when you started telling your story, it's like, it was like an earthquake. It was like something I'd never seen before, like something so horrendous, especially in like the very beginning of my career. It goes to show the power of the individual person to affect significant change. And that's what I would say is, for the people who are listening, I mean, they can get in on the fight. I mean, there's a million ways that they can help take down this behemoth, right? Either serving as a whistleblower, finding out which doctors are still prescribing these
naming and
interventions.
shaming probably works.
Yeah.
Oh, it
and-
absolutely works.
Yeah, and especially because they usually advertise their criminal conduct. They're because they've gotten away with it for so long. But that's what I would say.
I mean, this is a fight that took the coordinated efforts of people who have their different strengths, like all of us, the legislators, the average people who are just in everyday life, doctors, detransitioners, people who have actually been harmed or seen the harm themselves.
It just takes messaging.
I mean, if somebody, like, I started speaking out publicly when I was only 17 years old and I was still in high school. And if I could do that as a teenager, as a minor, I think everybody has a place in this fight.
I thought when I was deciding to blow the whistle, I was like, if this 17-year-old can do this, then like I'm a total coward if I can't. Like if I can't stick through this prosecution, then like
it's terrifying the dedication that Biden's DOJ put on your case. I mean, it's wild. And just like the trumped up charges that we've already gone over them that just don't legally have standing, and we're lucky it's over now. Although it sounds like you're still in the hole. That's a shame. Like not everyone can afford that fight.
I mean, no one can afford it. I mean, we can't afford it because we're still $1 million in debt,
Yeah.
It's one of those things that we've already kind of accepted that we're just probably going to be paying this off over the course of the next 20 years, possibly with Social Security.
Well,
hopefully
it's
not.
It's absurd, but at least you did the right thing. Both took very courageous steps and continue to. So thank you both for probably saving a lot of lives down the line. It's maybe an immeasurable number of lives, but certainly a lot. So thank you.
Defending reality and defending children is priceless.
Yeah.
So it's worth everything.
Yeah.
Well, it sure is.
And thank you for having me on again.
Great to have you.
Yeah.
Great to have you
Appreciate it. It's
both.
a privilege.